Hello, I am excited to talk about some of the work that's been happening in District 13, which includes Wallowa, Union, and Baker counties. We're going to talk about what's happening across the state and how they're putting the vision for transformation into action. And a little bit about the vision for transformation, specifically guiding principle number one, is we know that kids do their best when they're with their families. So it's exciting to hear the work that's happening in these three particular counties in District 13 and the work that they're doing in connecting with community partners. So again, delighted to have District 13 here, and I'll go ahead and start some introductions. I'm Alysia Cox. I am the Child Welfare Deputy Chief in Strategy and Innovation, and I'll pass it over to Chris Black.
Hey there, I'm Chris Black. I'm the District 13 Manager for our Child Welfare and Self-Sufficiency programs, and I will pass it to Brenda.
Hello, I'm Brenda Levitt. I'm the Child Welfare Program Manager for District 13, which covers Baker, Union, and Wallowa counties. And I will pass it to Chris.
Hello, I'm Chris Evans. I work as our Community Development Coordinator and get to support self-sufficiency and child welfare programs in our district. And I'll turn it over to Maria.
Hi, I'm Maria Weer. I'm the Director of Building Healthy Families. We are a regional nonprofit that focuses on parent education and family support, and we have been lucky to partner with ODHS in a number of projects, including the one we're going to talk about today.
Wonderful. Well, tell me a little bit more about your district and what excites you and what aligns with the vision for transformation right now.
Yeah, you bet. We wanted to talk a little bit today about a project that came to us, it's been a few years ago now. What has ended up being called the Eastern Oregon Community Resource Network. And so back, I think maybe around 2018, Tim Sinatra, who some folks listening to this will recall, Tim was in the director's office as the Director of Transformational Change was Tim's title at the time. And Tim happened across Chris and I at a conference we were at, and start talking about this community resource network that existed in Marion County, and that they wanted to look at other sites to pilot and attempt the same model, and thought of District 13 as an option for that, knowing that we have over the years really worked hard on establishing our community relationships and partnerships. And so Chris and I were really excited about the prospect and brought it back and began to work on setting up contacts with the communities, some meet and greets, and really to talk about the model, talk about what we felt the community's role could be, and to try to get that interest going. And I think because we do have some good relationships here, and we have really excellent partners in the community, several stepped up immediately, including Maria and Building Healthy Families. And one of the most exciting pieces of this, couple parts. One related to the vision for transformation is that community engagement piece, which we value pretty highly in the relationships we have. It started out as an ODHS project, but quickly transformed into a community-based project. And that to me is one of the most exciting parts about the EOCRN is that DHS brought it to the community took ownership of it. And it's really been one of the most successful community engagement projects that I've been involved with since I've been here.
That is excellent to hear. And I think you really highlighted a critical component to success is having our key partners, our core partners in the community lead and own this work, because they're the ones who can really see the transformative change when we're partnering together. And that they're the ones who see the needs and the gaps and the opportunities. So it's exciting to hear that Maria and other persons in the community were able to run with this and really own it. Thank you. Can you tell us a little bit more about the community background and your experience as a community partner, Maria?
Yeah, over the years, DHS has come to us with a number of projects and always looking for us to be at the table. Chris Evans is smiling because he often comes to us with great community collaborations and sits at a lot of the local meetings. So when they first started talking about the EOCRN, I was pretty excited. I think working in social services, we also work really closely with our medical community and our faith-based communities. We saw that there were just some needs that weren't being filled, and we were all scrambling around trying to fill them. And so this really spoke to something that was already happening in the community that we wanted to try to find a fix for. Really, they kind of put the pieces together and put the right people in the room. As I mentioned, part of Chris's role is to be at Cradle to Career or local community meetings. He planted the seed. He had us recruit more local partners. And then when we decided that we wanted to go for this project, it really did feel pretty grassroots from the people that needed to be there. And I think that the growth that we've had and the buy-in that we've had from our community just shows that exactly what Chris Black said. When we're a part of the thought and a part of the process and are kind of given run to take the lead, that's when you get true impact. So the ERCN has done that exactly.
Yeah, early engagement is so important. Appreciate that. All right, well, it sounds like you're connecting with the vision for transformation and supporting families and promoting prevention. What are some examples of how the EOCRN supports families, Brenda?
So an example we have is there's a young man in the community who he's couch surfing. He doesn't have a stable home, but he was recently employed and he needed help with transportation to get to work and back to where he would stay for the night. So a request would go out asking if someone could help with a taxi voucher to help fill that need. And those type of requests are answered fairly quickly, and those type of requests are what helped keep that young man employed and earning money towards a more stable situation. Another example of that would be we recently had a youth that we were helping care for in a hotel, and a request went out to request meals for that youth. And we had that need filled very quickly. We had several community members come forward and bring meals for him for several days. It was just phenomenal how quickly that happened.
Brenda, if I could add another example, I think of like the vision of transformation too, and honoring what families identify as their needs and how systems may not always have solutions to those. And I love the CRN for filling those kinds of gaps. So I'm thinking of like a CPS worker where I think was largely closing their work and closing their case and could be not involved in a family's life, but there's still some lingering things that they could benefit from having some help with. So like a broken water heater was one I remember where we did not have a resource for that, but our CPS worker was able to put out a request. Anybody know an electrician that could come and look at a broken appliance? It would really help resolve a lingering issue for a family. And that's another example of something that was filled really quickly and helped in those things so they don't kind of fall through the cracks.
That's an excellent example of you partnering, one, problem solving so quickly, and then partnering to get those needs met in such a timely fashion. I know when we're in crises or we have a need that needs to be met, time is of essence. So that's a really great example, Chris. The vision for transformation is centered around equity. How does the EOCRN play a role in promoting equity and sharing power with communities? Maria?
So, we live in really small towns, some of us smaller than others. And I like how anonymous the EOCRN can be. I think that really makes it equitable for families that have either had a lot of exposure, positive or negative, with community partners, or feel like they may be pigeonholed into a certain situation. I also think we've reached such a breadth of community partners from different agencies. I remember when we were going to not launch until we had 35 partners, and we're now over 220 from over 40 agencies. So we've really connected with agencies that work with underserved populations, so that those needs can be met that maybe weren't even on our radar. So I feel like on a lot of levels, it's really trying to eliminate the disparity, it's trying to close those gaps, and it's trying to reach those families that maybe weren't having a positive experience with equitable access to services or to resources.
I'm going to jump in with another example because another kind of cross-pollination piece of this is COVID response work that Maria and Building Healthy Families have done. And then through when we reached a milestone of the EOCRN with a 1 year, we were 1 year into our official launch, we wanted to do some things to celebrate. And so in a tangible sense, we reached out to a larger community of color through our COFA Alliance National Network, or CAN organization, that is a lot of community members from Palau, Micronesia, and Marshallese Islands. And were disproportionately impacted by COVID over the last 2 years. So in a tangible resource sense, we were able to reach out and help fill some needs for just some simple, maybe first aid kits and home health care needs. So thermometers and pulse oximeters and some of those items for those community members. But then in structural ways, that led to a better conversation of how can we have representation with our CAN community members in like the steering committee for the CRN. So those are also built to that, and those are our next steps going forward on the steering committee and representation as well.
Thanks, Chris. That actually reminded me to jump in. We've also been pretty diligent in making sure that our LCACs are connected, or our LCHIPs now. So in each of our 3 counties, we meet quarterly with our LCHIPs, and we get the feedback of what gaps are we missing. Here is where we're going forward. What are you guys seeing as, OHP consumers in our communities? Where are we dropping the ball? And so they've been able to provide some really interesting insight, or some surprises. Like, we didn't know that mattresses were this huge need in our communities, but we're really seconding that, like, this is what we're seeing. So I think getting the voice of parents and families from a variety of places and populations has been really critical in how we've decided to move forward.
Thank you for those examples and stories. I think it just further elucidates the power in partnership, and how community partners like yourself, Maria, and your organization really allows us the opportunity to hear what are the needs of our community. And having you in those positions to hear and then provide resources is just astounding. So very exciting to hear. I have chills, even though my house is heated to 7 degrees because it's still winter in Portland. But I do appreciate hearing a little bit more about the intricacies, the logistics, and of course, sharing of power, especially for our communities that are marginalized and would perhaps may not have access to these based on biases, et cetera. So very exciting to hear. If there is someone who's listening and they're interested in getting involved or wanting to hear more about how they can contribute as a partner, where would they go?
Well, it's a really easy website to remember. It's www.eocrn.org.
Thank you, Brenda. That's what I was going to say. From the website, you can send a message. You can ask to become a member. You could send a request just asking for more information, which would connect you to about 3 or 4 of us who get all of the email requests that come in. And, I think that we would take those requests to steering committee based on what it was, if it was another partner or somebody outside of our district. And we've talked a lot about how we're happy to share. We've even talked about putting together a toolkit so that other communities could establish community resource networks. So we're excited about what we're doing, and we're excited to answer questions and share what we have going on.
And I want to, Alysia, I want to add too, I'd like to acknowledge Amy Church, who has been a huge support and help out of central office in helping with coordination and facilitation, and has done a lot of legwork for the CRN, and who's also involved in the expansion of the CRN model, currently working on a project out of District 16 and 2, I believe, where they are going to establish a CRN there also. And so really want to shout out to Amy for all of her help she's given us in this project. And the only other thing I would add, is that, the CRN is an evolving thing. We're of course always adding members, and we're always looking at ways to continue to enhance what the CRN can do in our communities. We're looking at what types of membership we have, who we're missing. For example, we're missing maybe a larger segment of the business community, for example. And so really trying to think about recruitment strategies for bringing in more membership from the business community, whereas I know in the other sites maybe that is a strength for them. And so we're not just resting on kind of what we've done. We've achieved a lot. We did our membership, literally exploded. The CRN's been live for 18 months now, not quite. And for communities of our size, in our counties of our size, to have over 200 members between programs and individuals to us is just amazing and mind-blowing, and we're so grateful for those members. So
thank you, Chris. And I don't know if anybody else caught that, but 18 months ago, we were still in the pandemic. That was the initial start of it. To have something that is so widespread and supportive and really focusing on community partnerships in the community is astounding. I just want to commend you all for doing such incredible work in a time of unknown and resource lacking, that you were able to step in and provide PPE or whatever was necessary. The community elevated their requests and wants. So I just want to again acknowledge the work that you've all been doing in partnership, because for the vision for transformation to really be actualized, it's not just child welfare workforce doing it, it's in partnership in communities, it's the continued engagement with our tribal nations and lived experience and voices to actualize a vision for transformation, to go from a child welfare system to a child well-being system. And you're all doing that right now. That is so incredible, so incredible. So thank you for joining us today, hearing a little bit about the work in the Eastern Oregon and the Community Resource Network. Hopefully you can reach out with any questions you have to Maria and the website. And again, thank you all for listening about the work that's happening in child welfare.